and good to have you with us on this special edition of the Urban Debate here on Saturday evening on World Mental Health Day. So we thought we should take up another opportunity to talk about mental health, because it's perhaps been one of our biggest challenges in 2020. And mental health is an issue that's often ignored, brushed aside, denied in our country, considered a taboo by many families even now to admit, acknowledge or deal with the issues related to our mental health. And for us then to go in a state of a lockdown, to stay away from our loved ones, to have to maintain distance from everybody for months together, the fear of a job loss, salary cuts, uncertainty about our future, uncertainty about our children's education, their academic calendar, admissions, so many stressful issues. It's only added to the entire burden, and which is why it's extremely important for us to talk about it, to listen, to know that perhaps you and I, or anybody who's watching us tonight, isn't the only one who may be going through a tough time. And there's so many aspects to it, from identifying if what you are going through is anxiety or depression of any kind or any other issue. And if, like you, there are many others out there, what should you do? Or if you have somebody in your family who may be going through it, it's important for you to know how to identify what to do, what are the right things to say, what are the right things to do, what is the kind of professional help you can seek. All of that here tonight on the Urban Debate special broadcast. Let's talk about mental health and the stigma. Know that being anxious is normal, especially in times of a pandemic. It's even more important for us to recognize these things. Before I go across to our panelists, I just want to give you one example of what has happened this year. And this is actually a survey that was conducted across therapists, across the mental health care experts. 65% of them observed an increase in people who have self-harmed. 71% of these therapists said that more people have expressed suicidal ideation or a death wish. It's become that serious. 57% who took the survey said individuals who had previously recovered have now relapsed. Those who had made great progress, recovered, gotten a handle on the condition, have now seen relapse episodes. 62.3% of therapists said current COVID situation and doing only or mostly telepsychiatry has increased their own caregiver fatigue. It's a very important aspect. The very few mental health care professionals that we have are also feeling the fatigue. 75.8% of the therapists reported that caregiver fatigue impacted their ability to give 100% at work. 68.6% reported an increase in number of the people they see, and they said that a lot of these people were actually those who had never approached any kind of professional help before. First time cases. This shows you the gravity of it. Just today we had an unfortunate case being reported from Jabalpur in Madhya Pradesh, where a COVID patient who was also facing psychological problems jumped off the second floor of the hospital building. He died by suicide. It's the second such case in this hospital itself within the last 1 month. This too is a reality and must be spoken about. So let's say good evening to our panelists who are joining me this evening. Shumita Kakkar, mental health expert, founder and director of United We Care. Dr. Saida Ruksheda, psychiatrist and psychotherapist with the Trellis Family Center. Dr. Prakriti Poddar, also a mental health expert and managing trustee for the Poddar Foundation. And Anand Chulani, leading success coach and expert in mental health and mental strength. I actually want to start off with Dr. Saida Ruksheda. Dr. Saida, good evening and thank you for being with us. Just to understand, what is it that people are experiencing right now? For a lot of those who are watching us tonight who probably haven't identified if they are experiencing similar problems or pressures or anxieties, if you can talk a little bit about what one can feel or go through during a pandemic, a lockdown and an economic slowdown.
Thank you so much for the question, and it's a wonderful opportunity for us to be here today on World Mental Health Day because universally we need to talk about it more, spread more awareness. When we're talking about pandemic, it's brought about a whole different dimension of mental health and mental health issues and mental health disorders. What people are going through, like you rightly said, is an increased sense of anxiety, and we need to understand there is a difference between feeling anxiety, which might be a normal reaction to something which is a difficult situation, and having an anxiety disorder. So what we are noticing though is that all those people who have a genetic vulnerability towards psychiatric disorders, especially like depression, anxiety, self-harm, and suicide and substance abuses, their thresholds, which were previously okay, and they were coping with their stresses on a daily basis, were okay, and they weren't getting a disorder, now have jumped into having a disorder, unfortunately. And what people are not recognizing is, again, there is initially there was a lot of positive kind of interest in their mental health as well. And now everybody's like, oh, you're anxious about COVID. Everybody's anxious about COVID. So they're rubbishing it off. Or if somebody is approaching somebody that I'm getting anxious because of COVID or Corona, then they're saying that even now it's been 6 months, now you need to get over it. So we are seeing that difference, unfortunately. And because of there's movement restrictions, the social interaction has gone down. That's increased the sense of isolation and sense of stress, which is again triggering depression, whether it's reemergence of a previously managed episode or a new case entirely on its own. There's also that we are noticing that because there's lack of access, either due to the physical distancing or because of the sheer inability to get services, because they are very scared of going to the public health services, accessing psychiatric help via that. And we know that the public health services are overburdened and they don't have counseling and therapy services as much. So a lot of them are approaching, and I know me and a lot of colleagues of mine are doing a lot of pro bono work as well, because people who even previously could afford private care are not being able to afford private care. So we are definitely seeing these kind of differences from when we first started in the pandemic to now. And even the people who previously been okay, or they were in therapy from before, they were taking medications or treatment for other things, their sense of a financial burden has increased, and the worry, which is a very normal and natural worry associated with that, has increased as well. And unfortunately, because mental health and psychiatric disorders has been in the news for wrong reasons as well. And a lot of people with big, great platforms and a lot of volume in terms of voice is concerned, may have not really always imparted the right information about psychiatric illnesses, which has also led to a lot of increase in misinformation and stigma, really. So we definitely hope that that kind of goes down again. And we know when we talk about mental health from a scientific and a more empathetic manner, people understand better, and there's less in the myth that surrounds it.
Yes, absolutely. And I think the step one for us is to ensure that more and more people understand this. And in our country, if you see, even now, large percentage of our population is unable to identify if someone is going through a specific problem. They simply dismiss it. The one who is going through it wants to hide it, not talk about it because it's a taboo. The friends and family members don't get it, or the things that they say may not exactly be the right things to say, or may not even be helpful. In fact, subconsciously, we may be saying things that are actually hurtful or even triggering, a negative response in somebody who's already having a tough time. And I wanted to talk a little bit more about that. Shumita Kakkar, because, one is being unaware of what somebody around you may be going through, and in such a situation, maybe subconsciously aggravating it by the kind of comments we make or things we say and do. Can you shed some more light on that?
Absolutely, Tanvi. I think a very valid discussion going on today. And I think this problem of mental health being a stigma or a taboo is something that is a harsh reality. And stress and anxiety is just growing in numbers. We have now 200 million Indians who are going through a mental disorder as per Lancet. And this number is only growing with COVID being there. Uh, I think the first thing that we all just need to understand is that it's just okay if you're not feeling good or positive. It's fine. It's just okay to get worried. It's okay to get anxious. And the only thing you need to do is take counseling services, because just like the way when we have cold and fever and we rush to a doctor, similarly, when our mind is not at ease, we ought to go and just, talk to a counselor and feel more positive. And we as United We Care, I'm the founder and CEO of United We Care. This platform basically encourages people to come on our app and actually speak to experts, to psychologists, life coaches, and take counseling services from them. One more thing to highlight is a lot of people are very particular about not disclosing the identity when it comes to seeking help, or not talking to their friends and family that I am seeking help. And that's where I think it becomes very important for apps like United We Care to also give an anonymous, option where you can just go and seek help and think more positively and think, do meditation, do yoga, whatever the counselor gives an option to, or gives a solution to you, or gives a direction to, and helps you out resolving your issue. One more part, like Dr. Shahida rightly said, that not everybody can afford these mental services, and that's why there are few things that we have done on an app. And I would like to highlight that technology plays a very important role in helping people, cure the mental problems that they're going through. And on our app, we've seen a lot of people calling stress and anxiety related to, what's going to happen in future, with their jobs getting lost, with their children not studying, children going through anxiety because what's going to happen in the exams. There are different genders and there are different psychologists who are needed for such a thing. Also, from the technology aspect, we have our, wellness assistant called Stella. And Stella is somebody who can actually say it's an AI bot, but she actually understands feeling without any
Yeah.
cost attached to it. So that's what we are doing from our side with respect to
Yeah.
spreading the awareness of, mental health, and saying that it's just okay not to be okay, and just talk about it. Talk about it, take guidance, and feel better, because this situation of COVID is going to remain. And the only thing we must do is to have a healthy mind, because that will help us to have a
Yes.
physically fit, um, you know, being also.
Yes, in fact, there was also a survey conducted by the Suicide Prevention India Foundation during the lockdown, and those who were feeling depressed during the lockdown, 88% said they had anxiety issues, 76% said they had a job loss fear, or if they had gone through job loss or there was a fear of job loss. 73% said they had experienced stress. 73% said they had gone through stress related to isolation and loneliness. So this is a fact. But Dr. Prakriti Prodar, it's I want to also ask you to explain to our viewers the different kinds of professional help which is there. Not everybody understands whom to approach at what point basis what you're experiencing. A psychiatrist, a psychologist, a counselor, a therapist. How are they different, and how does one decide what we need?
Thank you for that question. Really relevant nowadays, because mental health has to be destigmatized. People need to understand where they can go and seek help. Most people believe that if there is a problem that they're facing emotionally, that they should just go and talk to their friends and family members. This, of course, there are professionals, as has been said before, there are professionals. Please seek help with professionals. There are also social workers who've been trained just in basic CBT, which is cognitive behavior therapy, and different forms of therapy. So a lot of call centers, like we have a call center as well, the Wellbeing Volunteers United, free of cost. And like Dr. Ruksheda said, there are so many people, good Samaritans, people, doctors who've come on and are providing their services. And for that, there we have two major qualifications of the people who are calling in. If somebody is calling in with any kind of suicidal ideation or self-harm, we directly move them to a psychiatrist. We do not handle the call in terms of the volunteer does not handle the call, the counselor does not handle the call. It's escalated straight to the psychiatrist, which requires immediate assistance. If somebody has any kind of hallucinations or they're unable to function appropriately in the day, immediately again to a psychiatrist. The rest of the things, if they're environmental mood disorders, the environmental disorders, which is, say, for example, COVID related, financial sense of loss, not grieving a loved one, not being able to meet your loved ones, not being able to connect or get a job again. These are all environmental factors, and this would require you to go seek help with a trained therapist, a counselor. If you have neurological disorders, you have to go to a neurologist. You have anxiety and mood disorders, go to a counselor. If you have addiction, you have to seek help with a psychiatrist, again, who will then have you also work with a counselor. Most psychiatrists, if there are problems that are intense and requires you to shift the way in which you're thinking as well, would ask you to seek help with a counselor along with their their medication or whatever they've provided for you, because it's an ongoing change in the way in which your behavior and the way in which your thoughts function. So if you find that you are, as a layman, if you have a sad mood, you don't need to seek help. Maybe a helpline will help because you're going through something which is a passing phase. If this continues over a long time, you definitely need to seek help, and medication helps in that. If you find that your loved ones are withdrawing, if you find that they're not communicating as much, take them first to a therapist, because they may not need to see a psychiatrist at that point. If there is a change in food eating or there's food eating disorder, the person stops completely, again, first to the counselor and then to the psychiatrist if it continues. If you see the person snapping a lot, if you feel like you're snapping all the time, anxiety and mood disorders, so you definitely take the person to a counselor first. So there are many different ways, but if there are signs and symptoms, if the person has ever mentioned, or if you've ever felt like this world is better off without you, you'll need to go to a psychiatrist first. No amount of counseling will be able to get to you as fast as a psychiatrist can.
Okay, thank you for that, explainer there, because I think it's very important. Most of us don't understand the difference and what it is that we may be feeling and who it is that we may be approaching. I also want to point out a specific, another specific study that was done, and this is published in Economic Times, related to workplace anxiety. Again, because in this year, even the style of working has changed for us. Corporates and companies have had to evolve, change their structures, change the way they work. There are many who find it difficult to now be, within in a constraint of a home with so many family members around. You don't have your own workspace. There are many who find it difficult because there are no boundaries anymore. You're getting calls 24/7. The work-life boundary has completely vanished. This study actually that was conducted by Oracle found that 91% of the respondents said they would prefer to talking to a robot over their manager about stress and anxiety, which is why I think many organizations are also now initiating that, which was mentioned by our guest as well. 93% said their mental health issues at work were negatively impacting their home life as well. 95% believed companies need to do more, and this is the most important one. 95% believe companies should be doing more to support mental health of their workforce. 65% feel that they are working more than 40 hours per month. In fact, many cases 45 hours now, and 32%, a third of them, were already feeling a burnout because of being overworked. That itself is adding to the problems. Anand Chilani, is there a lack of awareness now, even now, in a large percentage of our companies, of how they have to be also taking care of their employees?
That's a great question. I think, first of all, I'm thrilled and I'm honored to be here today with my fellow colleagues to really serve people on a day like this. And I think the most important thing I would say is, companies say, I work with a lot of companies, I coach a lot of companies. So many companies are about results and not about the process and not about the people that are going to get those results. And I think we're all human beings. And I think that the biggest challenge, you mentioned something interesting about people not feeling confident about speaking to their manager. Why? I mean, look at it from perspective. If I believe there's something, if I'm sick or I'm not well what does that mean? Well, in normal world, pre-corona, I think people would say, I need the time off. I'm not feeling well. I need the time out to be able to take care of myself so I can come back. In today's world, where people are scared of their job and losing their job, I think, especially in our country like India, which is so advanced in so many areas, but to me, growing in the area of understanding of mental health, we need to understand, we need to change this mindset that if I'm not feeling mentally healthy or well or strong or fit, it's not a weakness. It's actually honesty to come out, and it's actually powerful and strength to take ownership of it. In the same way, it's responsible and takes ownership, it takes courage, it takes strength to say, I'm feeling sick, I need to see a doctor. Just ignoring it and kind of put it under the carpet does not take strength. In fact, it takes weakness to do that. So being emotionally honest is so important. And the challenge is, if I'm an employee, I'm scared to tell my manager. Why? Because in my mind, my manager may look at it and say, well, there's something wrong with him or her, and therefore they need time out. Therefore, they won't be able to perform. Now, that person may not have that belief at all, but it's so easy. And I've coached people who have this, who thought there's something wrong with me, and my boss will see it a certain way. Either, what are the limiting beliefs? The limiting beliefs are my boss doesn't care, so I won't talk to him or her. The limiting belief is I won't engage with that person because they will look at me in a low way, and therefore my job could be on the line. The third way is I'm feeling this, but you know what? I shouldn't really focus on me. I should push that down to focus on what's in front of me. Well, either case is not going to serve you or the company, because the company doesn't just want robots. Just like any person, you want someone that's going to be is a human being. We want a boss that's a human being, and we want employees that are human beings. So to have that mindset, companies have to. To me, it starts with one thing. Before a boss can take care of the mental, emotional strength of an employee, to me, the boss, him or herself, needs to be mentally and emotionally strong and fit. Because an insecure person does not make a person underneath them feel secure. If you're secure in who you are, mentally strong, mentally fit, if you value mental health, mental fitness, and mental strength, then you will value it for your employee. But if you don't value it, then you're not going to make it important. So the first step is any leader, any manager, any person, whether they be a teacher, whatever level of leadership you are at, if you have people reporting to you, you're making your mental health, your mental strength, your mental fitness number one priority is actually taking care of them, because you have the tools to support them in terms of, not in terms of curing them or helping them, but you will create a space where you will value that and make them comfortable to come to you and say, look, I'm feeling a certain way. And then you can get the requisite professional to support them to shift that. But if you don't value it, it's useless. And I'll tell you something right now, if there's nothing else we've learned from this time of Corona, is that just value. I'm a success coach. That's my title. But let me tell you something. To me, happiness is success. And if we don't value happiness over success, then we will never shift anything. Then you know what? This whole thing is, we've actually regressed instead of grown. We have to value happiness over success. And happiness is in form of our health, our physical health, our mental health, our emotional health. Those three things have to be valued. So far in corporate world, they're at the bottom of the list. They have to be a level of value, level of respect, and let's have holistic success. Let's have holistic growth rather than just one dimension.
Okay. Okay, all right, point well taken. In fact, Shumita, do you want to come in on this as well? The responsibility also of the company that you work for, your employer, to ensure that there is a reduction in work anxiety, especially in a year like this.
Tanvi, a lot of companies are now approaching us, and I think they're realizing the importance of mental health for the employees, because I know I have this stats from WHO, which has estimated that the economic loss due to mental health condition today is going to be $1.03 trillion dollars, and this is between the period of 2012 to 2030. So companies are realizing that the productivity of people is going down because yes, they're not used to working from home. They're not used to having children at home. So, muting and then talking and attending conference Zoom calls. It's always on digital lifestyle, which is just adding fuel to the stress and anxiety that they're going through, and plus the fact of job instability. So a lot of companies have approached United We Care also to have dedicated programs for the employees. And I would like to say that even though companies are trying, but a virtual yoga session or something might not really help, because people are already fed up of coming online and uh, talking on Zooms and Skype. So they don't want that. What they need is a confidential place or a platform where they can open up to somebody one on one without the seniors even knowing what they're talking about. But it'll just help them reduce the stress. And that is why I think companies are getting very open to this fact of helping their employees come out and talk to experts one on one in the convenience of place and time which United We Care offers. So I'm very happy that companies are opening up to this, and I wish a lot of companies move very quickly on this step.
In fact, even as we speak this week itself, LinkedIn it's started a survey where they're asking people if they believe that the number of work hours also need to be reduced. And follow the system that many of the Western developed, highly developed countries follow of 4 hours or 5 hours. Because what we are witnessing in our country is the blurring of lines between personal life and work life. And people are on phone calls from 8 a.m. to 12 in the night. There's absolutely no break or differentiation between where you start and where you end. And I think that's something that companies and managers and executives really need to start looking at. But let's come back to the larger issue of mental health and what we need to do. And Dr. Saida, one other key aspect also is the impact on the professionals themselves. The fact that we have so few of them, hardly 3 per few million of people in our country, and the cases are on the rise, more people are speaking up. That is also going to lead to a lot more fatigue to the existing healthcare professionals. How do they take care of themselves?
Especially since the pandemic the lockdown has started, social restrictions, movement restrictions, even from a very personal point of view, I can tell you that especially in between, there were a few moments where I was heading towards burnout, and I had to kind of try, because even on Sundays there was something or the other going on, because there's so much of requirement from people. Even when I wasn't seeing clinical cases, I was going on live webinars, trying to talk to people, telling them in terms of what are good mental health practices and what are the possible symptoms to look for if you have a mental health disorder, and what to do if you have a mental health disorder. So we are a very human resource poor country as far as mental health professionals are concerned. We have less than 6,000 psychiatrists for 1.3 billion people, and we are not evenly distributed. We have, metro cities have more concentration of psychiatrists than other cities. I know even in metro cities, my colleagues psychiatrists, they're seeing at least average 100 patients per day, which is very, very tough for all of us, because we also want to give, want to make sure that we are doing the right diagnosis, we're doing the right prescriptions. And then when we talk about counselors, qualified, certified counselors who are therapists, and not just people who've done a few weeks of counseling and they think that apart from counseling, they can also do therapy. So we are very resource poor, and that is definitely impacting us quite a lot, especially, when we're talking about public health services. They are seeing a lot of people, they're trying to take care of. Just today, earlier in the day, I had a call from one of the junior residents from a from a hospital in Mumbai, and she got in touch with me because her roommate, who also is a junior resident in the BMC hospital, was having suicidal ideas and suicidal thoughts. And when I spoke to her, she's like, yeah, I went to my duty, I came back, but I don't think I can function anymore. So the sheer amount of work that they have is taking a toll. What we are doing, we are trying to be there for each other. We are trying to reach out and speak to each other. We are encouraging each other to take a break, which unfortunately we just don't have the time for, because there is so much work that needs to get done, so many people that need to be looked at. And unfortunately, there is an increasing number of suicides in mental health professionals, but also medical professionals, which is impacting us. If I'm a junior resident and if a friend of mine who's also a junior resident, who may not be a psychiatry resident, has died of suicide, that impacts me and increases my risk of suicide as well. We've lost so many senior psychiatrists because of COVID. Just a couple of days ago, we lost another one. The numbers are dwindling, and it is an appeal to all my professional colleagues, take care of themselves. We do have helplines actually, which are looking after, we are volunteering for professionals, for health professionals. If you're feeling bad or if you're feeling overwhelmed, call us, we'll speak to you, we'll try and help you out. So self-care needs to begin at home.
Yes, absolutely. And thank you for bringing those points out as well. The stress on the healthcare professionals themselves, both on the mental health and the physical health. Even our doctors and our nurses and staff that's been working round the clock in that kind of an environment where there's always a fear of getting the infection, where there's so many serious cases, you're not getting a break, you need to be away from your own family to protect them as well. They too have had a really tough time. Let me go across to a viewer though who's on the phone line. Seema Sharma is calling us from Noida. Good evening. What would you like to share? Okay, I think Seema's, we've just lost the line with her. We're going to try and get back to that caller who wanted to share her views as well. Our phone lines are open for anybody who wants to decide to speak, open up today, or if you have a specific query on where you can get help or how you can help somebody around you, how to identify the signs. We're here for that. Very quickly, in fact, let me take that point across to Dr. Poddar. Dr. Poddar, as a loved one or a family member or a friend, what are the signs that one should be watching out for? Often we hear this, that we didn't even realize somebody around us, somebody close to us was going through so much. It never showed, we never realized. What are the signs that we should be watching out for?
If you are talking about family systems, I think we need to actually allow the voice of our children to also be prominent. We encourage people around us in our families to not really display their emotions. That's number one. We focus on their success in the education. This is actually a real problem because stress with the youth, and the youth in India are really suffering from mental health disorders. So I think we need to first remove that system that blocks us from truly understanding what our family members are going through. We need to stop negating it and minimizing what they're actually feeling. So if they're feeling anxious, and we allow them to talk about their anxiety, to be able to take them to somebody who's able to deal with their anxiety, versus telling them that they're just going through a bad day. It really helps because we are then giving, validating what they're feeling, and apart from just validating, we're allowing their voice to come up, because mental health is muted. You're talking about muting people on Zoom. But mental health is muted in our country. I remember when I came and started taking over what is the Poddar Foundation, which is now focused on mental health, IEC, which is information education, and just communication. The whole idea was silence toro. It was all about break the silence around mental health disharmonies. We need to start this at home. We need to allow people to speak their mind and be comfortable. we have to be comfortable with other people's emotions. They have to be comfortable with their emotions. And only when we allow this comfort or vulnerability will we actually have success in identifying what the problems are. Because if you are blocked in your vision that there may be a problem that you're looking at, then you're not going to be able to find that. So therefore, this was a premise. But if you're looking at what are the signs and symptoms, any kind of shift in the normal functioning of a person would be something that you need to relate to. If the person, like I said, I think I mentioned this before, withdrawals of any kind, withdrawals from conversations, withdrawals from loved ones, withdrawals from friends, withdrawal from day-to-day activity, exercise, whatever that be that they were doing, any kind of shift in that is a clear sign that there is something going on. Any shift, like in your food pattern, yeah, and I mentioned this before, your moods are related again very closely because mind, body, and spirit are connected. When your food eating changes, like if you are overeating, binging, feel like you need excess sweets in your diet, there is something that your body is craving, which is linked to your mind. So you've got to check on that. If you have stopped eating, if you're curbing it, if you've restricted your diet, or if your appetite has just shrunk, there is a problem. You need to, as loved ones, as family members, if this is happening to somebody, please take them to a mental health expert. I know that you would probably go to a primary healthcare expert first and then to a mental health, when I say mental health expert, I mean doctors, right? But primary health care is good for them to drive you to the right place in terms of to meet the psychiatrist. Any kind of, excessive tiredness is another symptom. So if the person doesn't wake up, is not waking up, doesn't want to wake up, feels lethargic all day, you need to seek help and you need to take them to a psychiatrist. If the person is using maladaptive coping strategies, like if the alcohol binging has gone up, and this has happened, by the way, a lot during this lockdown, alcohol or smoking. I remember speaking to somebody who said, oh, I've just become a chronic smoker. I don't know what's happened to me. These are all signs that you're using maladaptive coping strategies to actually overcome some kind of stress. And if your family members are doing this, please take them to a psychiatrist, because they would be able to receive the kind of help that they need to be able to thwart this, short of becoming a very excessive addiction.
Something here.
Oh,
I
yes,
agree
absolutely.
completely
And
with
thank you so
what
much for actually. Go ahead, please.
Right. I completely agree with Dr. Kodar and everything. What we also possibly need to do when we're talking about improving mental health literacy, we need to bring in the science of it and not just the art of it. We need to make people understand that it's the brain functioning that's maybe doing less than what it should be doing. And that's the reason, just like if the heart is not functioning okay, you go seek help, which includes lifestyle management, and it also may include medications of certain sort. So when we talk about it from a scientific point of view, people understand that better, because everybody knows that you require your brain for your entire body to work as well. So when we talk about it in that sense and introduce that concept as well, in mental health literacy, it becomes easy. And empathetic listening is good for everybody. It's good at work, it's good at health, it's good at relationships. And everything contributes to my physical health as well as my mental health. So yeah, just if you have an illness, go take treatment, you're going to get better. If we keep it as 1 + 1 = 2, and keep that message simple, I think that acceptability will improve.
Okay, I just also very quickly wanted to check with Anand on this. Anand, a lot of people that I have come across or even read up about are talking about overthinking and ruminating too much becoming a problem in this pandemic times, especially when you're in a lockdown, you're away from people, your social interaction isn't happening up to the point that it was perhaps happening earlier, and that's maybe that or for other reasons. But how does one handle that? Should one be seeking professional help even for that, if somebody believes overthinking and ruminating too much is becoming an issue?
To me, what is the mind? Simple. It's a computer. That's what it is. It's a fast computer, and if you know how to program it, you can take control of it. And your mind is, I think we're going to get out of this thing that my mind is controlling me. There's a lot of power we have to influence our mind, just like we have a lot of power to influence our body. When you tend to think my body's just happening to me, my mind is just happening to me, we make ourselves a victim and we make ourselves someone who's powerless to change. And that sense of powerlessness actually puts us more into a negative state. I think two things. I agree with what Dr. Ruksheda said in terms of science, but I also say this, I think here's the challenge. I mean, I was on one of these news channels, and I remember someone talking about depression, a renowned psychiatrist, talking about depression, and said, yes, when people are depressed, they need to be more logical. I said, what? That's the most ridiculous thing I've ever heard in my life. To say that when I'm depressed, I need to be more logical. It's actually my left brain and the thoughts of my memories and all those things that's putting me into that thing. Logic's not going to take me out of depression. Being emotionally strong and emotionally fit is going to take me out of depression. If I need therapy, or I need counseling, or I need a psychiatrist, psychologist, that's going to help me out of depression. And I think the thing is this: whether you're working with a psychologist, psychiatrist, whoever you're working with, you are still the person who's leading the change. You're the person. You going to them is taking control of your life. And I think that's the key thing here, is when you realize I can take control over my life. I have more control than I have. When I'm overthinking, what am I doing? I am just literally, it's like, how many of you here watching this have ever, like on your phone or on a computer, you've had multiple windows open, right? And what happens when multiple windows are open, or multiple apps are open, or multiple programs are open? The computer slows down. The computer, that, if you've got a Mac, that disk ball comes, right? That's overthinking to me. I'm using a metaphor, but it's the same thing. We have too many apps open in our head, too many thoughts open in our head, too many loops open in our head. And we literally go into loops. Overthinking is asking the same question over and over and over again. When will this end? When will this end? And you ask some version of different versions of the same question, you're not going to get different answers. Change your question and you will change your life. Change the question you are constantly asking yourself, that you are you're not overthinking, you're over focusing on a certain thought, a certain picture, or a certain question. Change the over focusing on that, ask a different question, have a different picture, have a different way of looking at something, and you will break the loop, you will break the cycle. I think a lot of us just tend to just sit in that rut. And the challenge is, you can use the mind either to help you or to hurt you. I can use the same mind to find solutions, to create something. If I'm a business owner, to find a product or way of service of helping people right now. I can use that same thing, my same supercomputer, to find solutions to my children's education and find a way to educate them, even though they're responding digitally right now. There's so many things I can use that can help me. But asking the same question over and over again, is it hurting me or is it helping me? In the same way, when you eat food, if you eat a food, is that food making you feel good inside? Not pleasure. Is it giving you fuel, which is energy, or is it decreasing it? If it's increasing it, it's the right food for you. And I don't just mean a burst of sugar to give you energy. I'm talking about long-lasting energy. In the same way, is this thought in my head giving me mental energy or taking away mental energy? If it's taking away mental energy, if it's draining that battery, then what would I do? Would I put a virus on my computer and let it stay there? No, I would get rid of it. I would end it. I would find a way to say, you know what? Let me close down all these different apps and reboot. We don't take the time to reboot. We don't take the time to recharge. I did a 10-day energy challenge on Facebook Live. 10 days, and I brought on experts mentally, physically, emotionally, spiritually from around the world. And it's on my Instagram if you're interested in it. But I say this to you because people don't give themselves the value. One of the reasons we don't value mental health is because we don't value ourselves. We value what we do instead of who we are. And the way to break out of the loop is to say, first, I'm going to value myself. Second, I'm going to realize I'm in control of my life. And then learn the tools to control this computer instead of letting it control you. Nothing controls you. You are in charge of your life. And even seeking a therapist or someone to help is taking charge, because it's you taking action.
Oh yes, absolutely. In fact, and to what you've said, I just wanted to add a couple of more things which are, I feel, extremely relevant right now in the current era that we're living in. Perhaps in the last few years as well, but definitely in 2020 it's only worsened. We need to also surround ourselves with a lot more of positivity and positive news, or maybe cut and weed out the negative news, whether it's on our social media platforms, our chat platforms, WhatsApp, Telegram, wherever you're consuming your news from. You need to make a conscious effort of not constantly surrounding yourself with all kinds of negative news that's doing the rounds. Also, fake news. Keep yourself away from fake news that can be alarmist, that can just add to your own anxiety, that can add to your own stress in your mind. The other thing about the pandemic and the fear of the pandemic or the virus itself, we need to know that it's going to be here for a while. Slowly we will beat it and we will fight it, but it's not going away anytime soon. So don't pin all your hopes on a vaccine coming tomorrow and resolving all your problems. This is a marathon. We are in for the long haul, and so we need to be prepare our minds accordingly. We need to tell ourselves that, and then know that there is no shame in speaking up, in reaching out, in talking to your partner or to your family member, your parent, or even your closest friend, and reaching out for professional help. There are helplines available if you don't want to go out, or if you can go out, find yourself a safe space and talk to a medical expert, a professional expert. It is going to help you. Don't think that if you're facing stress or anxiety or any kind of paranoia or depression today, you can put it off and just wait through the next week, a few weeks, and everything will be fine. We are now in this structure, the way our lives have been designed. It's probably going to be like that for a while. So we need to find ways to make ourselves stronger and to help others around us, and to seek help for ourselves if we feel that is required, without stigmatizing it. Completely out of time, a big thank you to all of our panelists who joined us in this special conversation.